the reason why you have been treating infection for a long period of time, and after a while the infection will resurface again. If you are watching my video for the first time, welcome to my YouTube channel. I'm Patrick Onyedikachi. Please, if you want to learn more about your health, both reproductive and sexual health, sexual life, please subscribe to my YouTube channel and turn on the notification button so that whenever a content is posted, you'll be notified. Thank you. So today I'm going to tell you the 4 reasons why you've been treating infection and it seems the infection is not going. After a while, if you take medication, after some weeks or months, it will resurface again with the same symptoms. Number 1 is wrong use of medication, most especially in countries where drug supply are not properly regulated. In a situation whereby people, whenever they feel they are having symptom of anything, they are having any symptom, they will, instead of going to the lab or hospital to see a doctor, they rather rush to pharmacy to get themselves any drugs of their choice and start taking medication on their own, without knowing that some of these organisms, some are gram-positive while some are gram-negative organisms. And something like yeast also, if someone is having yeast infection and taking antibiotic doesn't cure yeast. And you cannot also use a gram-negative drug to cure gram-positive organism. It's not done that way. Number 2 is not completing your medications. Taking medication anyhow you like, any day you want to take your medication. If you're on medication and the doctor says you should take it 5 good days, straight 5 days, try and make sure that you take the medication as directed by your healthcare giver. Make sure that the medication is taken like that. Not you take today, you skip tomorrow, the next day you take again, or you are asked to take one in the morning, one in the night. You take in the morning and in the night you forget. Automatically the organism will resist, your body will resist that medication, and no matter how you take it again, if you like, go and get a carton of it, that drug will no longer work. So whenever you are given a medication, please take it as directed, exactly as directed. Just follow the instructions and take it as directed. The infection will go. It's as simple as that. Number 3 is reinfecting yourself. Reinfecting yourself. If you are treating infection, you are supposed to abstain from having intimacy with your partner, and secondly, your partner is supposed to be taking medication along with you. Whether the person is showing symptom or not, the person should also go to the lab and know if actually he or she is having infection or not. Because if the person is the one that infected you and maybe his or her own is not showing symptoms at the moment, and you are taking medication, and at the same period of time you are meeting the person again, the person will keep reinfecting you, and the drugs will resist, the organisms will resist. Because the more you take medications to kill the ones that is already in the system, the more the person is introducing more into the body, so it will not work. In that way, you are supposed to abstain from having intimacy with the person, and at the same time let the person also go for test and know that he or she is free from the infection. And number 4 is douching. For the ladies, douching also increase the risk of getting infection, because all these chemicals they use, whether medicated soap or antiseptic, so many things ladies use to douche, it also increases the risk of getting infection, most especially vaginitis. Somebody reinfecting herself with making the organisms, the normal floras in the body, to react, to overgrow, causing overgrowth of normal flora in the body, thereby leading to infection. So that is not good also. So whenever you are having infection, whenever you are having any symptom at all, before you take any medication. Go to the lab, meet your doctor, meet your scientist, run a test. The essence of this test you are going to run is that let the person know the kind of infection you are having. Is it a yeast infection? Is it a bacterial infection? Okay, if it is bacterial infection, is it gram-positive organism or gram-negative organism? And this test also will help to determine the antibiotics, the drugs that will be sensitive, the drugs that have the ability to kill the organisms. That is what the most important aspect of going to the lab, not going to pharmacy to get yourself drugs, because when you are getting yourself drugs, you don't even know if it is yeast or bacteria that is even causing the infection at the moment. Please, whenever you're having any symptom, go to the lab first and get yourself checked before taking any medication. Thank you. Please follow my page and share. Remain blessed.